All right, so I wanted to give an update. It has been 6 months of treatment now. I've been to the ER only one time since I've started treatment, so that's good. And I was sent back home, no worries, but you can never go by that. Long story short, it's a rare condition, and nobody really can say they specialize in it at all. So it's always best to listen to patients, especially in this situation where there aren't very many of us, and the only way to learn about the disease is to listen to patients. And that's a whole other discussion I'll get into. I recently saw a rheumatologist and didn't have a great experience, but nonetheless, we're moving forward. I am currently on 2,000 milligrams of mycophenolate, just also called Cellcept, every day. I take 1,000 milligrams in the morning, 1,000 milligrams at night. I have tapered down from 40 milligrams of prednisone to 20 milligrams of prednisone. I get 80 grams of IVIG infusion every month, but I've opted to have that broke down into two different infusions, so 40 one week and 40 grams every 2 weeks. So I'm getting, instead of getting it once a month, 2 days, back to back, I'm getting it every other week, 40 grams. Anyway, and then I was on baclofen as a muscle relaxer to help with the aches and pains and stiffness and all that. And I'm switching to tizanidine today. So hopefully that works better for me as I'm tapering off of my prednisone. I'm going to stay at 20 milligrams till I see my doctor again in April. I had some problems with my insurance, and I had a week delay, which isn't bad because I know people have had much worse, longer delays than that, and getting their infusions and insurance and all of that. And then also my insurance ended their contract with Northwestern, who was diagnosed and originally started my treatment. But I have a good neurologist named Dr. Charles Davies that I work with at the Carl Foundation Hospital here, who's also now working with the rheumatologist, Dr. Khan, in the same hospital to co-manage my disease for me. When all this treatment started, I was wheelchair bound and couldn't do anything, couldn't even shower independently, couldn't wash myself, none of that. I'm still in the wheelchair. Let me turn that back on. I'm still in the wheelchair, but I am gaining strength. I can move my arms around, I'm moving my legs. I can even push up and raise my stuff, my butt and my legs, but I can't stand fully yet. My shoulders still need some repair from being stiff for so long. I couldn't move them. I mean, I literally could not even raise them up, not even a quarter of the way. It was so painful. And now I can move both arms. While I do need help transferring, getting, to the toilet and into the shower, once there, I can do things independently. I'm washing myself the whole process on my own. So yeah, we're making progress, and got another 6 months of treatment. And then my CK is in normal range. It stayed in normal range ever since the first month of treatment. So I'm about to have a bone density test. They're going to do an x-ray of my hips, make sure my hips are okay. I'm going to have a CT of my chest, make sure my heart is fine. Doing some blood work checkup. So right now, I'm what they call stable. We can't really say for sure the disease is in remission until I'm tapered off the medicines, and I think the goal is to have me on Cellcept mycophenolate monotherapy, which means the only medicine that I would be on is that, just to control the immune response. So yeah, there's a lot more, and I'm planning on making smaller little videos to break down certain aspects of the other things I went through, like with insurance and just the, energy and vibe you get from different doctors who have different philosophies and have different attitudes, and, and dealing with that, overcoming that, and trying to navigate a rare disease while I'm fighting it myself. It's been very, very challenging. Luckily, I do have people in my home that are helping me and supporting me, but still, nonetheless, it's a battle that I have to fight, and I am definitely going to keep fighting. The goal is to get into aquatic therapy, which has proven to be hard because there's nothing in my local area that can accommodate my needs, being that I can't transfer. So we have to use a Hoyer lift to get me in from my chair to the pool lift and then into the pool. And yeah, you'd think they would have figured this out, and they think, well, we can just manhandle you and just lift you up, but you can't, because I'm a myositis patient, and anyone with myositis knows that we have what is called allodynia, which means we're very sensitive to touch, and it hurts bad. Like, just light touch can hurt us. So manhandling us by our arms could do more harm than good as well. So cause easy bruising, it hurts really bad. And it's really not good on my arms or my body to be having people lift me up, because I am heavier. I'm not really small. A guy can't just lift me up. So I know I need to lose weight too, which is a whole other thing. But one step at a time. One step at a time. The goal is to get stronger, which I am doing. I am not getting weaker. I have gotten stronger. And my CK is now normal for the first time in 22 years. So I'd say that's a win-win. But we still have a long way to go. All right, thanks for listening.